2 out of every 3 eligible people in the U.S. are fully vaccinated against the coronavirus. But the average pace of new vaccinations is slowing. Carter Evans is in California, where some people are protesting vaccine mandates.
Small but vocal groups of California parents are pushing back against a statewide mandate requiring all students be vaccinated as soon as they're eligible and the FDA gives full approval.
I think that we should have the right to be able to choose whether or not we want our kids to be injected with antifreeze and formaldehyde.
That's not accurate, and it's the kind of misinformation some parents are falling victim to, according to Dr. Peter Hotez.
Can you explain how this is not an experiment on children?
Research and development for over a decade went into this current generation of COVID vaccines. So these are as well vetted and tested as just about any vaccines we've ever used.
Today is the deadline in Washington state for public employees, healthcare workers, and school employees to be fully vaccinated or risk losing their jobs. Governor Inslee says he will not delay the deadline.
This is the last time you'll hear me in a state patrol car, and Jay Inslee can kiss my.
In Chicago, the police union says more than a third of officers still have not reported they're vaccinated, and their union leader is urging them to hold the line.
I really hope that the men and women of the Chicago Police Department are not going to ruin their careers over going to a website and saying yes or no.
Nationwide, 18 states and the District of Columbia have vaccine mandates for at least some state workers. But Washington, Oregon, and Massachusetts are the only states that won't allow opting out of the vaccine with a weekly test.
Do you think we can get to the level we need to be at as far as vaccinations are concerned with these mandates?
No. Ultimately, we're still going to need cooperation with the governors and elected leaders of states that are not buying into it at this point.
California already requires students to be vaccinated against the viruses that cause measles, mumps, and rubella. Enforcement of the COVID vaccine mandate could begin as early as January, but the governor here says it's more likely to apply to students in 7th through 12th grades in July of next year. Elaine?
Carter Evans, thank you. For more, I want to bring in emergency medicine physician Dr. Owais Durrani. Doctor, thank you very much for being with us. I want to start with the news about Colin Powell. As we know, he died from complications of COVID-19, even though he was fully vaccinated. At the time, he was also battling a form of blood cancer. Did that make him more vulnerable to complications?
Yeah, thanks for having me this evening. You know, I had the pleasure of meeting General Powell about a decade ago when I was a freshman in college, and he, left an inspiring mark on me. He was, generous with his time, inspirational, down to earth. So my thoughts go to his family. As you mentioned, he was in the highest risk of categories. His age alone put him in a high-risk category, and then multiple myeloma is a cancer of the blood cells, of the plasma cells in particular, which are in charge of creating the antibodies that we all talk about. And so when you have multiple myeloma, you have a weakened immune system. Secondary to that, on top of that, you have treatments that also weaken your immune system for the multiple myeloma. And so that combination of factors puts you in the highest risk of category. That's why it's so important for all of us to get vaccinated. And so, I'll have young, healthy 20-year-olds say, hey, if I get sick, I'll probably be fine. True, but your grandparents might not be fine if they're dealing with one of these immunocompromised situations.
Is it clear, though, doctor, for people with those compromised immune systems, like cancer patients, will vaccination offer enough protection against the coronavirus? Is that just dependent, person to person?
Yeah, so it'll be dependent person to person and how advanced the disease you have is. So having one type of cancer, being caught super early versus something that is spread all over is going to be two different situations. We do have data from Israel, though, that when these immunocompromised groups in general got a booster shot, death rates went down by over 50% in that group. So we still know that vaccines work and boosters work. They're not going to work as well as they do in a healthy 20-something-year-old, but vaccines are still effective. And then it's incumbent on the rest of us to make sure that we aid that protection that this individual is getting from the vaccines.
Well, 2/3 of eligible Americans are fully vaccinated, and nearly 80% of adults have had at least one dose. Doctor, is this still a pandemic of the unvaccinated?
Well, the short answer is yes. We've seen that vaccines work and they prevent people from getting hospitalized. We've seen that as vaccine mandates have gone into places, hospitalization numbers have fallen in areas with high vaccination rates. And we've also seen that mandates work. And so I think now is the time, as we're heading into the winter, as we're seeing the caseloads drop, to really double down on mandates and ensure that people get vaccinated. We've seen they work in the healthcare setting, they work in the United States military, they work in many private corporations. And so it's all about, getting into this winter season prepared, making sure that we're not infecting our elderly, and that so we don't have another surge.
Well, the CDC added mental health conditions like mood disorders and schizophrenia to its list of underlying conditions for vaccine eligibility. Why is this important?
Yeah, the short answer is mental health is health. For far too long, we have treated mental health as not an equivalent to cancer or diabetes or heart disease, but it truly is. We've seen in about 2 to 3 studies that came out over the past few months that depression and schizophrenia were risk factors. And schizophrenia in particular was secondary only to age in terms of poor outcomes from COVID-19. Now, we're really not sure why that is. It might be the biology of the individuals with these diseases. It might be the medications that they're on. But we have clear data that proves that they are at an increased risk when they have these diseases. And I applaud the CDC for treating mental health as any other health condition and allowing these individuals to get boosters and making sure that they get the care that they need.
So the CDC has not yet recommended mixing and matching vaccines, but it did say those who get doses of different shots can still be considered fully vaccinated. Explain to us that decision.
Yeah, so we have data from a lot of European countries that have been mixing and matching over the past couple of months that show that you do get an adequate immune response and antibody response when you get a mix and match shot. Some data has actually shown that you get a more robust response. And so for the sake of considering them fully vaccinated, it is the right call to consider them fully vaccinated. Now, we're getting some data from here within the United States over the upcoming days and weeks that'll kind of give us a better indicator into when you mix and match that robust response. Is that extra antibody boost going to give you longer term protection, or is it just kind of a shorter term thing and getting the same dose of the series that you're on is equivalent to that? And so we'll get more data on that over the upcoming weeks and months, but indications do show that mixing and matching works to prevent you from hospitalization and death.
Well, coronavirus cases are beginning to rise in a handful of states, but overall, the nation's infection rate is falling, with the daily average down to just under 68,000. Doctor, can we avoid another catastrophic winter surge?
I think we can. I think it's a really exciting time. A lot of us avoided travel and meeting up with our families during the holidays, and so the possibility of doing that this year is really exciting, and I think people should be excited about that. We just need to ensure that these dropping numbers continue to drop and we don't stay at a really kind of high baseline level where we can have another surge from that. To my patients, I tell them, if you can get vaccinated, if you're eligible to get vaccinated, and hopefully we'll get some vaccines for younger kids approved at the end of this month, beginning of next month. And so that'll be number one. Number two is going to be traveling in a safe way. And so wearing masks when you're traveling, hand hygiene, and ensuring that you're taking every precaution possible. And then it was good to see that the Biden administration is investing in testing. Testing is going to be key to getting us through this fall and winter, and taking those rapid antigen tests before you meet up with family members and travel. So I think if we do all of those things, we'll have a winter that is bearable and enjoyable, honestly.
All right, perhaps a bit of hopeful news there. Dr. Owais Durrani, thank you very much, doctor, for sharing your expertise with us.
Appreciate you having me.